So when we see children that are dysregulated at any or some combination of these three brain systems, the brain stem, the encephalon, or the limbic system, these are the behaviors we begin to see. And these behaviors continue into adulthood. So don't just think it's a kid thing. We see agitation and irritability. Now, we're not just talking about the occasional time when you're a little bit irritable, because we all do that on occasion. We're talking about this, man, they're harsh all the time, or most of the time. Agitation and irritability, sadness, grief, and depression, feelings of hopelessness, feeling numb. One of the defenses, if you're in an emotionally charged state all the time, is you don't want to feel, because you're always upset. So you begin to shrink your feeling range down. And also, if your adaptive range is shrinking, you're also kind of shrinking it down. Suspicious and untrusting. You have a lot of outbursts, emotional outbursts, screaming, yelling, crying. This is where we start getting ready for addiction. Self-soothing and distracting behaviors. Think that might play into addiction? What about poor communication? Does that play into addiction? You can have very articulate people, but they're not very good at either stating their own emotions or actually living in the states that they're in. They want to change that state. That has to do with how they communicate. What about social withdrawal? What about social isolated behaviors? Poor attachments. We get a lot of inappropriate attachments, but we don't have a lot of healthy attachments in people that have substance abuse histories. Preoccupation with objects or environmental elements. Now, this is true for people that are dysregulated, but let's move it now specifically to someone that's addicted to a behavior or a substance. What do they become obsessed with? If you're obsessed with meth, you're going to be obsessed with getting it. You're going to be obsessed with the places where you can go to get it or the environments you can use it in. What about heroin? Same thing. What about exercise, if you're addicted to exercise? You're going to spend a lot of time thinking about exercise? You're going to be looking for places to do it? What if you got the George Hamilton addiction? You're going to be looking for those tanning booths in town, okay? Figuring out how to use them, how to schedule them in. Generally, you get preoccupied with stressors. Now, when you're preoccupied with stressors, what do you tend to do? You tend to overreact to them. Does that make sense? When you are focused on stressors, you tend to see them more often, you tend to see them more richly, you tend to react to them more strongly. This is not a good thing if you've got an addictive quality about you. What about these? Difficulty concentrating and focusing or attending. Has anybody known someone that's struggling with this? Now, as a child, we get all sorts of really wonderful labels for this. ADHD, ADD, oppositional defiance. But essentially what we're basically saying is their brain has been dysregulated enough that they just don't have the ability to focus. What about this one? Difficulty making decisions. What about decision making? Why is that a problem? So when you make an emotional memory, or when you make an emotional decision because you feel it so strongly, what happens when your emotion changes? The decision goes, bye-bye. Really, empowerment, personal power, is really being able to make a decision and follow through on it, regardless of what the emotions do. I mean, think about what you've been able to do in your life. If you based it all on emotional decisions that you made, you wouldn't be very successful. Because your emotions change pretty frequently. I mean, think about, and I don't care how wonderful your marriage is. There are days you probably would say, and if you had made the decision to be in this relationship because of an emotional decision and you run into those moments, you're going to walk out of it. You're going to bail. Now, how many of you have ever been able to sustain any emotion for a long, long time? If you think about it, you may get it recharged, but generally, you kind of, you may not think about how much you hate your brother until you're actually having to talk to him or be in the room with him. When you enter a new relationship, your limbic system plays a trick on you. I'm serious. This is absolutely true. Deborah Tannen's done lots of research on this. You enter a state called limerence, which means there are certain hormones being pumped into your limbic system. Now, for you women, that can last up to 18 months. For men, rarely lasts more than 90 days.
That makes sense.
Now, which is good for we men, because one of the side effects of this chemical cocktail that's going into your limbic system is you're going to overlook a lot of our flaws. You're just not even going to see them, or if you see them, you're going to say, "Oh, that's okay. He's such a good guy." And it's not until you start exiting out of limerence you go, "I really don't like that behavior too much." Okay? But limerence is a biological trick that keeps you, that helps build relationships. But if you build your relationship on your emotional experience, you probably aren't making your best decision. And those countries that have lower divorce rates don't usually allow emotional decision-making around marriage and coupling. They use, arranged marriages. So, and we all look at that and go, "Oh, that's horrible." But they don't have the divorce rates that we do. Now, they may not also have the intense, wonderful Hollywood romance movie beginning either, which is probably a really good thing. But it's all driven out of that limbic system. So I've gotten kind of far afield from what I was trying to talk about. Poor decision making, difficulty following through on decisions to accomplish goals, because that requires you to do it even when you don't feel like it. Anybody who's worked with addicts of any kind realize that you hear that a lot. "Well, I don't feel like it." Okay. What about this one? Engages in pointless lies, deceptions, or partial truths to avoid. Now, that's all part of that when those systems are dysregulated. Nightmares, anxious behaviors, worry about pleasing others, physical complaints, mystery pains, suppression of emotion. Wonderful diagnosis called somatization, or somatoforma pain disorder, where there is no medical reason, physiologically there's no thing broken or hurt that they should be having this pain. It's being generated by an emotional condition. You almost always can go back and look at these three systems being out of whack is related to that. So we see this really in a lot of families where there's young children that have been chronically dysregulated. They will ache and hurt for no reason. I mean, certainly there are normal pains in growth for a child. But when every time a certain family member is home, they're sick, or they have stomach aches, or parts of their body hurt, there's a certain part of that is related to this. Some people have it to the point where they have tremors and seizures, and you hook them up to do MRIs on them, and there's no medical, at least as far as our technology can detect, there's no reason why they should be having them, but they're having them. And what you then begin to do is do what we call a stress catalog on them to when are they stressed, when are they most stressed, when do these occur, that kind of thing. And of course, acting much younger than they really are. How many of you that have worked with any addicts have noticed you have a 50-year-old person that is behaving quite emotionally like an 8 or 9-year-old or a 10-year-old? That's a pretty common thing. But it's not just in addictive behaviors. Anybody that's kind of grown up in these environments, you'll find that they tend to behave emotionally immature in some ways. Not always, but in some ways. Are you all familiar with what magical thinking is? Just because I talked about it, it's true, must be so? Yeah. Okay. And then aggressive acts and violent acts. So these are the things we see when the brain is dysregulated.